Tens of thousands of Johns Hopkins patients with UnitedHealthcare. Insurance in limbo as the two parties failed to reach a new contract agreement. The deadline has come and gone, and without a new deal, that means one of the state's largest medical providers will now be out of network for thousands of Marylanders.
WJZ Live at 5:30. Tara Lynch on your corner at the Johns Hopkins Medical Campus in East Baltimore with what comes next. And Tara, you also spoke with a patient advocate who says this puts extra stress on patients.
Denise and Nikki, these patients already undergoing a lot of stress in terms of their health because they're going through several procedures and different treatments. The patient advocate I spoke to says that this just creates unnecessary uncertainty and confusion for a lot of these patients who are dealing with difficult times already. In a statement, Johns Hopkins Medicine said it's prioritizing patient protections and improving access to care. It will continue working on a deal with UnitedHealthcare, and it also said that it will try to get that in-network capabilities back here for that insurer. In a letter to patients, the provider said, quote, "We will not sign a contract that allows an insurance company to prioritize their profits over our patients' health." Meanwhile, UnitedHealthcare blaming Hopkins, saying it tried to reach a middle ground, but Hopkins wouldn't budge on a deal that would be bad for employers and members. UnitedHealthcare said in a statement, Johns Hopkins refused to move off contractual terms no other healthcare system in our network requires, including language that would allow it to deny patients access at its discretion. Despite our repeated efforts to compromise and extend our contract to avoid disruption, Johns Hopkins refused. Jamie Imhoff is a patient advocate who says in the end, it's the patients who will suffer.
And also noting that this isn't the only system. I'm also a patient of Capital Women's Care, for example, that lost that. I am tending to lean towards more responsibility on United taking care of its members, its paying individuals that are counting on United for healthcare. I think the burden lies on them.
Both Hopkins and UnitedHealthcare say that some patients who are receiving continual care and treatment are still eligible for in-network benefits. You should reach out to United to see if you are eligible for that. We're also learning that other providers in our state and patients who have UnitedHealthcare are losing access to other providers, including Capital Women's Care. Again, UnitedHealthcare patients who are patients at Capital Women's Care have lost their coverage here today as well. We'll have much more on this coming up tonight at 6. For now, reporting live on your corner in East Baltimore, Tara Lynch, WJZ.
Very distressing. Thank you, Tara. Well, for